I've had to intubate intoxicated patients with really high alcohol levels. Mm-hmm. I've had to intubate Xanax overdoses just temporarily, just to be able to protect their airway.
Which is why when people are under the influence of things, they cause accidents, because all of those senses are dulled.
Yes.
Because their parasympathetic system, they've taken alcohol, which is a depressant.
Exactly.
Right? And so their reaction times are slower.
You are listening to EMS with your hosts, Erik Axene and Matt Ball.
I think I may have had 1.5 beers in the last 5 years. A total of 5.
Like, you don't like a beer on a cold day, on a hot day, on a real hot day, like after you...
That's what water's for.
Well, no, but I'm not saying I do it, but on a hot day, like, there is something... I'm not a big beer guy either. Well, like, Devin, our film guy,
he's big
I say,
beer guy.
Why am I telling Devin, our film guy, to you? Like, you don't know who... I had to define who he was in the
friends.
organization. Yeah, I'm not a big beer guy, but, like...
I got a funny story to tell you.
All right, go ahead.
Because I asked Devin this very same thing. I said, because I love mowing the lawn. On a hot Texas summer day, mowing the lawn.
Yes, I remember you doing that in your
thirsty,
sweats.
Sweating like crazy.
See, me and you, everybody thought I was crazy. On the hot, I loved working out in the bay when it was 105.
Me too.
They're like, you're a psycho. I'm like, no, dude, I want to be dripping in sweat.
Me too. Mountain biking, I love it in the heat.
Yes.
Most people stay home when it's 100 in hell.
No.
I'm out there on
my motorcycle. People are like, it's too hot to ride. Like, well, then don't buy a motorcycle, wimp. You live in Texas.
I'm with you. I'm with you. I don't agree with most of what you say, but I do agree with that. No, fair. But I was talking to Devin about this, and I said, Devin, there's nothing like a cold Topo Chico, a sparkling water, like right out of the fridge after a hot, really hot.
You're such a good human. And Devin goes, yeah, there is.
A beer.
A cold Michelob Ultra.
But he made such a big deal about how refreshing it was. And there's part of me that wants to like beer. Yeah. So I thought, you know what? That's what I'll try. I'm going to get really hot, and I'm going to go slam a beer.
Oh, don't slam. I didn't say slam it.
Well, that was the impression I got for him.
Okay,
so I thought, well, I'm just going to, because I'm super thirsty, right?
Yeah.
So the beer that I had was really high alcohol content. It's called the Velvet Hammer.
Oh, well, you were drinking like, okay, yeah.
Yeah, so...
The Velvet Hammer?
And so I don't normally drink beer at all, right?
Yeah.
So I came in hot, dehydrated probably, and I drank that beer.
Did you follow it with a shot of Lagavulin or something?
No. But it was not refreshing. It was not refreshing. It only enraged my wife when I came in and said, I'm feeling a little lightheaded here. Anyway, so...
no, I like to have it like Corona. My wife and I like Corona. If we're going to drink a beer, like a Corona, it's probably what we would pick. But yeah, Corona on a hot day, just one. Yeah. Like one, I'm not talking about... No. That's when a beer tastes best,
Dr.
I guess.
Pepper or a cold water or a Topo Chico, or to me that's refreshing.
Well, that's good. Well, yeah, I would. Yeah, I don't know. There's something about a beer.
There is something about refreshing about.
You feel like a man after you've been mowing all day and you're all hot and sweaty and you drink a beer.
I did not feel like a man that
Makes
day.
You feel like a man.
That Velvet Hammer did not feel like a man.
Well, I don't know if you'd feel like a man drinking a Velvet Hammer. That just.
Well, actually, there's another. I had broken my arm teaching my son how to skateboard.
I remember this story.
And the fire department brought me a bunch of funny gifts.
I know.
And my colleagues in the ER set me up with the OBGYN bed, and it was kind of a funny thing.
Had the stirrups and everything.
Yeah, they did. And I got discharged home with some Norcos, and I'd never had Norco in my life. And I took one of those Norcos, and I was acting so funny that my wife thought maybe it was a head trauma, so she wanted to bring me back, which is kind of what we're talking about today, are toxidromes. Yes. Whether you like slam a Velvet Hammer when you're mowing the lawn, or you take
that just sounds weird when you say it like that. Can I tell you my story? The first time I ever took opioid pain medication.
Okay.
Or narcotic, I should say narcotic pain medication.
They are narcotics.
I had been kicked in my former life. As you know, I used to train horses. Mm-hmm. And I had got kicked. I was breaking a bunch of colts in a round pen up in Washington State. We had this little stud colt who was kind of a little jerk. He was being a little jerk as I was trying to, get him ready to get him under saddle. And so I kind of tied him up, just like, okay, you're going to go think about it, calm down a little bit. Like, you're just a little too riled up. And so, like, sometimes you got to either work them, and I'd worked him for a while just to kind of get some of that energy out, tire him out, and then I was going to go tie him up. Well, I went to go tie him up, and then I came over to, like, they call it sacking a horse out, where you'll take a pad and you just kind of flop it on them.
Yeah.
And it desensitizes them to having something on their back. They call them sacking them out.
Sure.
So I was walking up to him with this pad, and you just kind of flop it on. It doesn't hurt him. You're not hurting him. But as I walked up, he saw that pad, and he freaked out, and both hind legs kicked at me.
Oh,
and thank God, if I would have been a step closer, he would have hit me dead center in my chest. And I mean, he fired. Really hurt you. Oh, he fired hard. Both hind legs. He full on kicked. And so as he goes to kick, I just kind of went like this and put my hands up, and he hit this thumb and crushed this thumb.
Broke it?
Oh, yeah.
Yeah.
So I am about 10 miles away from where I lived at the time.
Yeah.
And I had a 1993 Chevy single cab 4-wheel drive stick shift pickup truck.
Awesome.
And now I'm like, so I'm kind of sitting there, and it's kind of bloody, and I know, I'm like, oh, he broke my thumbs broke, like I just knew. Yeah. And so I drive back. Anyway, I won't get into the story. Anyway, my thumbs broke. I go home, and I got a prescription for Vicodin.
Yeah.
And I get home, but the pharmacy was closed. By the time we got out of the emergency room, it was like 2 a.m. We get home. I wake up at like 5, 6 a.m, and my thumb is killing me.
It is, yeah.
Throbbing, killing me. But the pharmacy's not open yet. So my wife can't go get the pain meds yet. So I go over to my boss, and I'm like, dude, I am dying. Like, do you have anything? And he gives me, like, I think he gave me like 1,000 milligrams of like Advil. He's like, here, take a bunch of Advil. So I pop these Advil. Well, then an hour later, the pharmacy opens up. Donna goes and gets me the Vicodin, come back. And I have never taken narcotics, ever, in my life. And I don't remember how many I took, but I took like 2 Vicodin. Oh, yeah. Oh, no, I mean, I didn't take like go crazy, but I took like...
We're talking about toxidromes today. Are you breathing?
The max dose. Donna came in, my wife came in like an hour later, and I am drooling on the couch. I am so gorked out of my mind, but my arm didn't hurt anymore.
No, that's good.
Those pain meds do have their place.
You know, it's funny. I think one of the best anti-theft devices you could purchase on a vehicle is a manual transmission.
Oh, 100% nowadays, for sure.
If you have, you might as well leave the keys in the ignition.
Yeah.
Nobody's going to steal it because nobody knows how to drive it.
Yes, and the person that would steal it or would know how to drive it wouldn't steal it.
That's exactly
right. Yeah, exactly. Yeah, why are there 3 pedals? Yeah.
Well, we're going to talk about toxidromes today, and we kind of hit on it a little bit, but a toxidrome is a recognizable pattern of signs and symptoms produced by a class of toxins. So there's a certain class of toxins that will present a certain way, and we're going to talk about each of those classes today.
Yeah, constellations, that was the word.
Constellation of symptoms.
Yes, that was the word I saw. I was like, I've never... Toxidromes in EMS are I can't talk. Constellations. I was like, isn't that stars?
That. That's good.
Yeah,
no,
that was
stars.
Yeah, I was like, that's an interesting way to put it. Anyway,
it's a constellation of symptoms that, just like a constellation of stars will look like a certain picture, like the Big Dipper, which is actually a bear, or maybe it's the Sisters or the Pleiades, which is the Subaru
is actually a bear?
emblem. Yeah, the Ursa Major. Ursa means bear in Greek.
But the Big Dipper looks like a big ladle.
It does look like a spoon, but apparently it's a bear.
Really? Okay. Yeah. Well, we won't get off on that topic.
Big bear, little bear.
Well, I knew there was a big bear and little bear, but anyway.
Ursa Major, Ursa Minor.
We're getting crazy here.
Well, anyway, but my point though is that these toxidromes, these categories of drugs or toxins that we could be exposed to, will all look very similar to each other. Right. So the first one we'll practice with is something very familiar to you.
Probably the most common one.
Yeah.
Yeah.
Is the opiates.
Yes.
And so an opiate overdose, example of an opiate would be like Vicodin, Norco, morphine, heroin, fentanyl, carfentanil.
Yep.
These opiates will have a certain toxidrome associated with them. So you'll see a patient that's got pinpoint pupils, is maybe
decreased respiratory,
because you put up too many opiates on those mu receptors in the brain, it shuts your the brainstem down, and the pons and the medulla, which control your breathing reflex, are now suppressed and blocked, and so you stop breathing.
Yep.
And so to treat these folks, we need Narcan potentially. We've got to bag them back up. You know, a lot of folks don't realize this, but slamming some Narcan on someone who's really hypoxic and not breathing, really low respiratory rate, not a real good idea. It'd be better to bag them up first.
100%.
And then give them the Narcan.
And carfentanil, and we talked about this in our opioid lecture, that carfentanil is so potent. 10,000 times stronger than morphine.
That's right.
So, and we've talked about this with our crews, is that you might not carry enough Narcan on your truck to overtake that carfentanil.
That's right.
So it's better that if you go bag on them, intubate them.
Yep.
Tube them if you have to, right? Yep. Obviously, follow your local protocols. But yeah, with this new carfentanil that's out on the street, if you go on somebody, pinpoint pupils, 0 respirations or very low respirations, be bagging, maybe push, a half a milligram of Narcan, a milligram of Narcan. Yep. I would go 2 milligrams of Narcan. And if you're not seeing a lot of improvement in their respiratory effort, either, like you say, continue to bag, throw in NPAs, OPAs, or maybe consider just intubating the patient because they're going to need time for that to get out of their system.
Yep, that's exactly right. Supporting the respiratory drive is the key management component and concept to an opiate toxidrome.
And remember, we're not, at least most agencies, most situations, we are not giving the Narcan to try to get the person to wake up. Mm-mm. We are just giving it to improve their respiratory drive. That's all we're doing.
That's correct.
Yeah, if they wake up on side of that, that's fine. But that's not the intent.
No.
Right? So if somebody's breathing fine, and even if they tell you that, I took some fentanyl or I took some heroin or whatever, okay, well, if they're breathing fine and they're talking to you, they don't need Narcan.
That's right.
Right? They don't need it. Mm-hmm. So anyway, most protocols are only giving it in that.
Yes. And that, right, follow your protocols, right. But that's why we do the Narcan if we need it. But bagging them is really the standard of care.
Control that airway.
Because they've lost the reflex to breathe. Sometimes we may need to step in and breathe for them.
That's right.
So that's just an example of a common toxidrome, a deadly one. Actually, a lot of people are dying because of an opioid epidemic. So kind of an important one to talk about.
Probably the biggest one,
a real common
and probably
one.
the most common one we're going to run across pre-hospitally, for sure.
But I would say, though, that it may not be as deadly as some of the ones we're going to talk about today, but they're not as common.
More common, but less deadly.
That's right.
Exactly.
So, and easily treated.
Yes.
Which makes it sad that so many people are dying from it, right?
Yes.
So the buprenorphine, the Narcan availability for even the nasal Narcan.
Cops are carrying it. Everybody's got it. I got it in my truck.
Yeah.
We were doing a class and a lady came in because her son died from an overdose. And so now she got this free, everywhere she goes, she carries around these Narcan. And she's like, if you want some, take it. And so I grabbed 2. I thought, well, heck, it can't hurt to have it in my truck. You never know.
You never know.
You could run into somebody having an issue. But they're 4 milligrams, which is interesting.
Yeah.
Those in nasal, they're 4 milligrams, which obviously you're giving it nasal.
Good, yeah.
Which an IV one, you're giving about half a milligram. So the dosing's way different. Yeah.
So we're going to move into another class of toxidromes, actually, that are related to our autonomic nervous system. It's really our autonomic nervous system that's going to build the constellation of symptoms that's going to help us to identify these toxidromes. Mm-hmm. So let's talk a little bit about the autonomic nervous system first.
Okay.
So there are 2 types. We talked about the manual transmission earlier. Mm-hmm. I don't know if I told you this. I love racing cars. Have I told you my racing car stories?
I think you have told me. Well, I don't know stories. I know you've told me
used to be a driver for the Baja 1000.
Yes.
We had a race vehicle that we'd race, and then went to...
which I would totally do that. Why don't we ever do those cool things?
Fun.
Why do we get tased and IO ourselves and shoot each other with paintballs and do hot chip challenges?
Well, these vehicles cost millions, and it doesn't cost much to get tased because we're idiots.
Anybody out there that has millions of dollars and would like to sponsor Matt and Erik to go drive a race car, I'm a good size for a Formula One driver. I'm a smaller framed guy, so lightweight. Move faster.
Well, I love racing. It's one of those things that I wish I would have had more time to do.
And money.
And money. I had the opportunity to go to a race car driving school.
Yeah, that's what you told me.
With Michael Andretti and a bunch of world famous, like Le Mans drivers. And anyway, and I was one of the few people that wasn't. Most of the people in this room, about 100 guys, were professional drivers of some kind. Mm-hmm. A lot of folks in NASCAR, Truck Series, karting. And I remember karting.
What's karting?
Oh, go-karts, like
go-karts.
Go-karts.
Okay, got it.
And I pulled up in my Honda Civic at the time.
Heck yeah!
This is years ago. And
stick shift.
A Honda Civic, and I pulled up next to a guy in a Ferrari Enzo.
Okay.
With the Nomex gloves and booties and suit and everything, and here I am in my board shorts and a T-shirt and flip-flops.
What's up, bro?
Yeah, so anyway, I was excited. It was fun because I just had always just loved racing.
Yeah.
And And this was actually my very first taste of racing.
Okay.
But I'll never forget it, though. All 100 of us ended up cycling through different kind of...
Didn't you beat them all?
I did.
You have the
I won.
fastest time?
I
I was
did.
going to say.
And I got up to accept the award on the podium at the end of this event, and he said, "You played football, didn't?" Well, actually, first he assumed I was a driver, and I said, "No, I'm not actually. I came here in my Honda Civic." He goes, "You played football, didn't you?"
Well, look at you.
And I did. I played football in college, and
obviously.
I think that he's seen it before, is that sometimes some athletes are more aggressive with driving. And I did it again in East Spartanburg with another event, won that one too. So I love driving. I wish I could do it more. But the autonomic nervous system is a lot like a race car.
Right.
When you push that accelerator, that's the sympathetic nervous system. It's that fight or flight response where everything gets ramped up and prepared to run or to fight.
Yep.
Whereas when you have the parasympathetic nervous system, it's like the brake pedal.
That's right.
It's like you're slowing down to take that corner,
Right.
hit that apex just right.
Yep.
Anyway, so you got the two systems, the fight or flight, the gas pedal, or the feed and breed, the brake pedal, the green light versus the red light. So by understanding the autonomic nervous system, you can identify some toxidromes that hit those receptors of the autonomic nervous system. So, for example, there are beta receptors on the heart. That's why we give people beta blockers for blood pressure, as you know. The sympathetic nervous system has beta and alpha receptors. And so when you bathe the body in something sympathetic like norepinephrine, epinephrine, adrenaline, cocaine, methamphetamines, you'll have a sympathomimetic syndrome, a sympathetic nervous system syndrome, basically,
Right.
the fight or flight.
Right.
Right now, if a Wolverine walked in here and you and I had to protect our kids,
Yeah.
you and I are going to be fully bathed in the sympathetic neurotransmitters.
Pouring in.
Right.
Yeah,
So
adrenaline.
when that happens, describe our bodies. When the norepinephrine, the adrenaline is there to protect our kiddos
Yeah.
in a room with a wild animal,
Yeah.
you and I aren't going to be thinking about our safety.
Pupils are dilated. Respiratory rate is dramatically increased to
Exactly.
increase
You got
oxygenation
it.
to the blood, to the muscles.
Yeah.
Heart rate's increased. Blood flow. All of the things, like you said, getting ready to fight and defend. Yes.
Isn't it amazing?
Oh, it's totally
The way the body's designed, all of those body systems with those beta receptors are going to get turned on and ramped up.
Yeah. Hearing even improves.
Hearing.
Yes. Everything. All your senses are
your
amplified.
senses, your peripheral vision's more
Yes.
sensitive. Your
Yes.
reaction time goes down. Everything is going to benefit you in a fight or a flight.
Which is why when people are under the influence of things, they cause accidents because all of those senses are dulled.
Yes.
Because their parasympathetic system, they've taken alcohol, which is a depressant.
Exactly.
Right? And so their reaction times are slower on things.
That's exactly it. And that's what I want our students to see is by understanding this autonomic nervous system, you'll be able to identify some toxidromes, and it'll help to explain some of the other toxidromes which we're going to talk about today. So if somebody were to take cocaine, which is like the fight or flight kind of
It's
narcotic,
the jet fuel of,
or methamphetamines, it's going to simulate in some ways the adrenaline and some of the other things. So cocaine, let's just use cocaine as an example. What do the pupils do?
Are we going to actually use cocaine? You're just talking
hold on
about
a second.
We're going to snort a line of cocaine. This is going to be one heck of a podcast. Get ready, folks.
Just wait till we get to the alcohol section and the heroin section.
Do you want to do the upper first or the downer first?
Gosh. I think I would start,
I would start with that.
If we started with the downer, we may not live long to get to the uppers.
Be snoring. Somebody call 911. All right, so
anyway,
cocaine.
Cocaine.
Sorry, I
you
diverted us.
Snort a line of cocaine,
Okay.
or you.
Although I've had a friend, I personally have never done cocaine, but I had a friend that
Neither
did,
have
and he said when he did cocaine, he said he literally could like bench press a truck, like he could go I don't know if that's everybody's experience, but he said you just feel invincible, just like superpower.
Well, I'm glad you mentioned it because I was actually going to talk about this.
Sorry.
I'm going to I'll just fast forward it just for a moment. Is woman was her kid was somehow trapped in a car.
Yes.
And this woman was actually able to lift the car in a way where she got her kiddo out.
Crazy mom strength.
Yeah. So when you have the cocaine, or when your sympathetic nervous system is fully engaged, your muscles are at full capacity, full strength. You're not normally at full capacity all the time, but when you get ramped up with a sympathomimetic, you're going to have great strength. And that's part of the reason why PCP folks are at full strength. They're ramped up as part of that. We're not going to get into PCP today, but anyway, my point is you take cocaine, it's going to hit your beta receptors. So on your eyes, you're going to have dilated pupils. You're going to have an increased heart rate, vasoconstriction. You're going to have anyway, all these. I'm sorry, vasodilation.
I was going to say.
I flipped them around.
It's okay.
The alpha receptors. So anyway, and then we also have the GI motility is going to go down because when you're in the middle of a fight trying to protect your kids or something, you don't want to be having to shunt blood to the large intestine.
You need your blood in your muscles.
And that's part of the reason why when you're stressed out and you have a lot of these catecholamines in your body and you eat, you'll get indigestion because your body, because you're stressed out, is turned off the GI system, so you get that sore stomach and poor, just the GI doesn't function well because it's kind of turned off. But that's typically what the toxidrome would look like for somebody who's taking cocaine or methamphetamines. They're going to be tachycardic. They're going to have dilated pupils. They're going to be sweating. They're going to. All of these things are going to be happening, and it's going to be an identifiable source where you can ask, have you been doing cocaine? Have you been doing methamphetamines? Or do they have a history of that, right? You can kind of put things together. Management for these folks, sometimes they can be pretty agitated and crazy. You take enough of them, you can even go into bad heart rhythms. So EKG may be important, or but a benzodiazepine can really calm these people down. Beta blockers can help too, depending upon your protocols. But because obviously if you're hitting the beta receptors, a beta blocker can help to minimize some of the effects. So that's the sympathomimetic syndrome. Now there's another one. It's an anticholinergic syndrome.
Oh, you didn't talk about parasympathetic.
Well, I am going to.
You're going to do that later. Oh, okay. Well, I thought we were going to.
Well, no, we could. Let's do that. I like it. We're on a podcast. We can do whatever the heck we want.
Do whatever we want.
So
we got parasympathetic. Or we got sympathetic.
So cholinergic. So the parasympathetic syndrome, or what we say cholinergic, because it's acetylcholine. Cholinergic syndrome. Let's talk about that. So if somebody was exposed to a bunch of organophosphates or insecticides, there's also or atropine, and there are certain types of syndromes or meds that will hit the parasympathetics. What will those patients look like? Kind of the opposite, actually.
Totally the opposite, yes.
What will the pupils look like in somebody with a parasympathetic or cholinergic syndrome?
Yeah, they're going to be very constricted.
Constricted.
Just like your opioid guys. They're going to be probably altered, maybe. That's right. Maybe not totally conscious.
Yep. Bradycardic.
Respiratory rate's going to be down.
That's right. Yep. So all these things are and with the cholinergic syndrome too, you're gonna have a lot of diarrhea potentially. You're gonna be a lot of saliva, the tear ducts. I mean, you're gonna basically be leaking fluids out of every hole. Sludge. That's right. So that's the cholinergic syndrome. So the GI system's ramped up. It's going crazy. Your bladder, for example. This is actually an assessment question, but the bladder. When you're fighting, do you want to need to take a leak when you're in the middle of a fight? Hold on a second.
I mean, it might stop the fight.
Just pee on him. I played football with a guy that would pee on himself to make himself smell bad, and it was weird. But
that's being dedicated to your craft.
I know. It was weird.
I would better football than wrestling.
Yeah, that's true. That's a good point. But anyway, so but your bladder will relax when you're in the sympathetics, so you don't have to pee, right? Your bladder relaxes, so you don't feel the urge to pee. Whereas with parasympathetics, you're going to get the urge to pee. Your bladder's going to constrict, and then so that's part of the whole cholinergic syndrome, the parasympathetic syndrome. Now, anticholinergic would be anti-parasympathetic, which would equal sympathetic. So it'd be very similar. The anticholinergic would be very similar to the sympathetic.
Sympathomimetics.
Right. So you're basically shutting down parasympathetics. You have unopposed sympathetics, and so these drugs are going to create that anticholinergic syndrome. Benadryl is a good example of this. Diphenhydramine, and so you overdose on that, you're going to have a patient who's tachycardic. Dilated pupils, hypertensive. But one of the things about these is they're mad as a hatter, mad as a hatter, dry as a bone. There's a whole acronym that we go through in our lecture.
Yeah.
You should watch it if you want to get into more detail there. But these folks aren't going to be sweaty. They're going to be dry.
Right. Which is how you can tell the difference.
Correct. And they're going to be altered.
Right.
It's typically not what you'd see with somebody who does cocaine.
Yeah. They're not altered. They're just hyped up and maybe agitated.
One thing, we should go back to cholinergic real quick. One of the management priorities for this, one of the most important things, is if you're on with somebody who'd been exposed to some sort of a nerve agent or insecticide or organophosphate, you can get it too.
Yeah.
So wear your PPE and protect yourself if you think this could be one of those toxidromes. So that's another reason why it's important to identify them.
Yes.
Now it's a hazmat issue.
Yes.
So be careful there. So you can see how the autonomic nervous system, understanding that, can really help you to identify some of these toxidromes. And I think that's a big part of this toxidrome lecture, because it's like teaching somebody how to fish versus giving them a fish, right? It's like you could identify a bunch of diseases.
Yes, makes a lot of sense.
Yeah.
So anticholinergics.
Yep. Anticholinergics be like cocaine or sympathomimetic syndrome,
but
and
dry.
then the cholinergic. And the cholinergic would be wet everywhere.
Yes.
Literally
Literally everywhere.
And then be careful on protecting yourself with PPE. Now we're going to get into some weird ones. Another common overdose, which we'll just cover real quick. You know, unfortunately today there's a lot of people who overdose on medications in an attempt for self-harm. The first one we're going to talk about, I'll start to describe it and you tell me when you think you know what it is.
Okay.
So, and again, like most of these things, the diagnosis isn't hard. It's knowing what to do sometimes, or being patient and keeping your eyes open. So we got a patient who mom calls 911 because of self-harm. And you get there, you got this 13-year-old boy with mom. He'd been making threats to overdose, and his kiddo's totally normal, you know, and maybe 12 hours later, you get called back again because he's yellow. He's got abdominal pain in the right upper quadrant. He'd been overdosing on something that hurts the liver, which is a common thing to overdose on. What is the medication that hits the liver? Common overdosed medication. You know what that one is? Aspirin can do it. Tylenol. Acetaminophen.
Yep.
And then another common one that people, Benadryl is another common. But in this case,
I've never been on a Benadryl overdose, an intentional Benadryl overdose. Really? You say that's common?
That's when you'll get the anticholinergic.
Yeah. But I'm saying I've been on several aspirin overdoses.
I feel like it's like I've seen it all. I mean, especially working where I worked at a psych facility.
Do you remember that patient I brought you?
Which one?
That was a Tylenol overdose.
No.
That you and one of our colleagues that works here as well.
Adam,
No.
Oh.
The other one.
Okay.
The intubated. It was his first time he intubated.
Oh yeah, that's
and
right.
And that kid, he was totally.
Yeah, gorked out.
Yep.
Yep.
Wouldn't respond. Anyway, that was a Tylenol overdose.
Well, that's it. So Tylenol overdoses initially are normal. You really dependent upon. Like we talked about with some of our other lectures, the cardiac lectures, like you need parents' history.
Right.
This is the same thing, because a lot of folks who want to really kill themselves, you won't tell you, and there's no sign to look for, other than maybe an empty pill bottle in their pocket or something like that, right? But folks who overdose on Tylenol initially will have no symptoms, but later on, we will see symptoms. Abdominal pain, jaundice, or yellow skin.
Horrible way to die, by the way.
It is. So when you overdose on Tylenol, you're creating a toxin that pickles your liver. So that's a toxidrome. That's a delayed toxidrome. That's really important to identify and see. And that's why it's so important to get these people to the ER before they become symptomatic to get the NAC. Yeah. Another common one that's overdosed, we already talked about Benadryl, is antidepressants. So antidepressants they basically suppress the reuptake of serotonin.
SSRI.
That's right, SSRI. So if you give me a fist here. All right, so I am the nerve coming from the brain, connected here like two extension cords linked up, and then this nerve maybe goes to wherever in the body, right? This is called the synapse. If you're listening to this, our fists are together like two extension cords plugged in.
Let's go like this side, so it's
there
the
you
same
go.
side.
And you have this is called a synapse.
Yep.
And to communicate between the two nerves, we use neurotransmitters. One of the common ones in the brain is serotonin. So the serotonin is leaving the presynaptic side, my side, and then it's going to enter or hit receptors on your side to continue the message. I have these things that will help to reuptake my serotonin so I can use it again. SSRIs are selective serotonin reuptake inhibitors.
Right.
If I inhibit the reuptake, serotonin levels go up.
Yeah.
So if I overdose on an SSRI, my serotonin levels are going to go through the roof.
Yeah.
Too much serotonin can be really deadly, and you get a serotonin syndrome,
Right.
which is going to look a lot like a cocaine overdose. But this is really weird, though. When you have an altered patient that looks like, and you're trying to figure out, is this anticholinergic or is this, sympathomimetic? Is this cocaine? Is this Benadryl? Or trying to figure it out. You get a good history, right? If they overdosed on an antidepressant, it's probably an SSRI. There are other types too that can ramp up your serotonin. But you're going to get this weird rhythmic shaking of the hands or the feet, where you move the foot up and it just starts uncontrollably moving around. That rhythmic shaking of an extremity can be a sign of a serotonin syndrome. It's a weird reflexive thing that they'll do. So on physical exam, if you notice some rhythmic shaking, they're hypertensive and febrile, tachycardic, altered, dilated pupils, all that stuff happening. It's not always cocaine. It's not always some of the other things we talked about. Serotonin syndrome can be super deadly. And a lot of it's supportive care. A lot of it is just keeping the fluids in and supporting them. These patients may need to go to the ICU for a period of time because this is deadly.
Yes.
And this typically happens like when your patient has a history of starting an SSRI, they can actually get a serotonin syndrome without overdosing.
Unintentionally, yeah.
Right. But when somebody is taking an SSRI and then decides to overdose for self-harm, you can go into this serotonin syndrome with that weird rhythmic shaking of the hands and the feet, and that might be your only sign, really. And this is a commonly missed syndrome that can be really deadly. And identifying it, the treatment and the management is really, really important. And there's another one, which I don't want to get into too much, but there's another common medication called neuroleptic malignant syndrome, which is the antipsychotics. So you have this patient that overdosed on their antipsychotic medication. They will have a similar syndrome too, but instead of happening like over 1 to 2 days, like a serotonin syndrome, this NMS syndrome happens over like 1 to 2 weeks.
Right. It's prolonged.
Yep. And so it's a patient that started a couple weeks ago on a new antipsychotic, and now they've got all those symptoms. But in this case, instead of the beating hands and feet, they have what's called lead pipe rigidity. Lead, like their extremities like a lead pipe. It just
lead pipe rigidity.
will not move. And that's something when you see an overdose syndrome with that arm and leg or whatever that will not move, it's really rigid, then you might want to think about this. Nothing specific, it's supportive care, give them IV fluids, get them to the right facility, they may need ICU care. But those are some of those weird toxidromes.
Yeah.
We don't need to spend a lot of time on those, but that's an interesting toxidrome.
It's interesting.
Now, you mentioned this earlier. There's another weird toxidrome we need to get an EKG on, the TCAs.
That's right.
Less common, though, today.
Yeah, they used to be prescribed more often, and I think they've kind of backed off. Amitriptyline is the one I've seen the most.
Still around, though. And there are other medications that are TCA, that create that wide complex tachycardia.
That's right.
And
Tricyclics.
And the cool thing about this toxidrome is that we can treat it.
Oh, yeah.
We can give them the bicarb.
That's right.
And that helps alkalinate the blood, and it can help to treat these folks.
That's right. Don't be worried about the bicarb either. It's relatively safe medication, especially in this. But I mean, like the ones that I've had, usually you find the bottle and you can read it and be like, oh, okay, this is pretty obvious. This is a TCA overdose, But get him on that, or get them on that monitor, and you'll have that wide, complex tachycardia. It won't look like VTAC. It'll be wider. It'll be pretty obvious. And if you don't know, like the bicarb, I mean, obviously history, right? But yeah.
It's accessible. It's easy. I mean, to the wrong patient, it could be hurtful. It's
Sure.
like for a dialysis patient, bicarbs
yeah.
like drinking a bag of potato chips. A lot of potential volume overload with all that sodium.
Right.
But that's a common kind of a classic, I should say, not common, but classic presentation for wide complex tachycardia with an overdose, TCA given bicarb.
Yep.
And then I think one of the other ones that just mentioned briefly is again a different sort of a toxidrome, but something that we commonly see, especially in these winter months right now. It's cold here, right? Mm-hmm. At the beginning of the winter, you turn the heater on in your house, and then you get this history of a bunch of family members with headache and dizziness. Even abdominal pain can happen. Yep. But the carbon monoxide toxidrome, carbon monoxide syndrome.
Yep.
And do you guys measure carboxyhemoglobin?
Mm-hmm.
You have that capability?
The rainbow attachments on the monitors can.
Okay, cool. Mm-hmm. I don't know that we do in our place, but
I bet you do. But if they have the
so?
rainbow sets on
Okay.
them, yeah.
So the O2 sats will be normal in these folks.
Yes.
I know you know this, but maybe some of our listeners don't. But when you do a pulse ox, you're not looking at the hemoglobin.
No, you're looking at
the plasma. Yeah, you're just looking at the plasma, and the plasma is full of oxygen.
And it's the saturation of it.
That's right.
You're not looking at oxygen.
No,
it could be in 200 times, greater affinity.
Yep, that's right. And the problem, actually, we kind of talked about this with fever. When you have a fever, you change the oxygen dissociation curves. You actually offload more oxygen to the tissues, which is really helpful when you're sick.
Yeah.
And carbon monoxide's the reverse.
Yes.
It holds on tightly, so it's not offloading anything. So you're starving your tissues because of the affinity that carbon monoxide has with hemoglobin.
Yeah.
It's really interesting. So the treatment for we talked about the presentation, multiple family members, maybe the beginning of the winter time, or could be maybe they were using the barbecue inside.
Overdose. Or, I'm sorry, attempted suicide.
Attempted suicide, that's right.
In a car. Yep.
So what's the management for these people?
Cyano kits. Well, first off, you get them out of the environment.
Get them out of the environment.
Right. Number one, first off, you keep yourself safe.
Yep.
Make sure you have a breathing apparatus on or something. But you get them out. The other one is a structure fire.
That's right.
Get them out of the environment, right? Get them to fresh air. And then get your IVs. If you carry a cyano kit, you can start doing that. Yep. And then you're going to take them to a facility probably that has a hyperbaric chamber.
That's right. That's exactly right.
You're going to want to do that.
You can do some high flow oxygen and
right. Yes, of course.
En route or whatever. But you're right. Ultimately, they may need, depending upon how high their levels are.
Right.
High carboxyhemoglobin levels are going to require some pretty invasive care.
Yes.
Maybe hyperbaric oxygen or whatever. But it can be deadly.
Oh yeah.
In fact, I think they said, I can't remember the mnemonic, but it's the people who die of carbon monoxide poisoning are just bright red.
Yeah.
Yeah.
There is a famous story of a guy. He was a captain. He was one of the most famous captain that worked on Rescue 1 in New York, Manhattan, FDNY. Very famous captain. He came down to my department one time, taught us an extrication class. But everybody thinks when they kind of think of firemen, they think of a guy like you. 6 foot plus, 200 pounds of muscle, blah, blah, all that stuff, right? And this guy, he's like 5'8", 5'9", 180 pounds, just looks like everybody's dad. Yeah. But this guy's one of the most well-respected captains ever on Rescue 1.
Awesome.
I mean, this guy was the guy. He was the man, right? Well, a famous story is they were in some tunnel rescue or something, and he had to crawl like 500-600 feet into this tunnel. Yeah. And he became overcome with carbon monoxide and became unconscious in this tunnel. And they had to drag him out.
Oh, gosh.
Yeah. We're talking 500 feet below grade.
Yeah.
He had to be drug out. Well, this was back, I don't remember the show, but there used to be a show where they would follow around the FDNY and whatever. And it was like a month later, he's back on the truck running calls, and they're on this other call, and all these guys are coming up to him. They're like, "Hey, Jimmy, how you doing? I heard about you." He's like, "Yeah, it was nothing." You're like, "Yeah, he almost died." He almost became so toxic that he was unconscious and had to be drugged 5 feet. He's like, "Yeah, it's no big deal. It's fine. I just spent a little time in the hyperbaric chamber. I'm good. I'm back to work." It's like, oh my god. Wow. Yeah, famous story. But yeah, and definitely a threat for us as firemen. Again, that's the importance of wearing your breathing apparatus.
Yeah, keeping yourself safe. Just like those organophosphates or the cholinergics potentially could cause, you could become a patient right next to them.
For sure.
If you're not wearing your PPE.
Yes. I remember going on a CO alarm call because most, obviously with all the alarms and the prevention systems, if you have gas in your house, you probably have a CO alarm somewhere, right?
Yeah.
And so we had gone, a lot of times we'll get called, people come back from vacation and their CO alarm's going off.
Yeah.
Right? So while they've been gone for a week, they left a burner on or it wasn't, whatever. And we walked into the house and we had little meters that we'd walk into the house. And I mean, the second we broke the threshold of that house, that monitor started screaming. We go, whoa, get out. There's nobody in the house. They had come home and, but yeah, that thing. So we immediately had to put on all of our stuff and go in to find where's this thing leaking at. But the bright cherry red skin,
For the seal,
the rainbow. Again, the rainbow. Sometimes they have a different monitor. SpO2 probe specifically is the Rad 57 that we used to use. But most of the life packs or the monitors nowadays, if you swap out the cords, they'll be able to measure CO. So you should be able to measure that.
A couple other stories of overdoses. We didn't talk about these toxidromes in it. There's an overdose on antifreeze is another common one people will do to hurt themselves. And the interesting one there to catch that, obviously if the patient's non-responsive and can't help you figure out what they did.
Yes, I remember there was a
blue light, or like black light on the urine. It'll glow.
Oh, okay.
The way that.
Because antifreeze glows. Yeah. And then there's also the way of, if you want to slowly kill somebody, put eye drops in their drinks over time.
Eye drops?
Yeah, you slowly put eye drops. There's been numerous
eye
people
drops. Like what?
I'm trying to remember it's the chemical in eye drops. But if you take a massive amount of it, and it's antifreeze. Same thing with antifreeze too. They'll try to slowly kill their loved ones by putting.
Kind of reminds me of the movie Sixth Sense. Remember that? There's one of the parents was making their kiddos sick, Munchausen syndrome. Munchausen by proxy.
Yeah, in the Sixth Sense? I don't remember that part.
Yeah, I think it was that movie.
It probably was. I just don't remember.
But the toxidrome, you can identify some of these things. One of the coolest ones I caught actually was a woman who was diagnosed with breast cancer. She was living in a commune somewhere out in the sticks somewhere, and she was the pilot for the community.
The pilot?
The pilot. It was kind of an interesting story, but anyway,
Where was it? Like what area?
I didn't ask a lot of specifics, but I'm assuming they must have like an airstrip or something out there in this commune. Anyway, she'd been diagnosed with cancer recently, breast cancer, and so she had was doing some sort of a thing with apricot pits. Eating apricot pits is the treatment for her breast cancer because it's apricot pits are really high in cyanide, and it's a poison obviously, but at low levels, by taking a certain amount of apricot pits, you can the cyanide. The thought was it would kill the cancer cells. I'm not saying this is the right treatment at all, but I'm just saying this is what she was doing. Right. And we didn't know that, though. We got this unresponsive patient that were called out to this community, brought into the hospital where I was working, and we were trying to figure out what the heck was going on.
Yeah.
And finally I got this history of the apricot pits, and I realized what it was. The syndrome that we were looking at, which was it just looked like this patient just, no matter what we did, the patient just kept getting worse. Pressors didn't help. Nothing was helping with this patient. Well, what was happening is what cyanide does is it just strangles every cell. It basically uncouples, or it basically destroys your mitochondria, or it makes them useless. And the powerhouse of the cell, those mitochondria, are absolutely essential for all your 37 trillion cells to be able to use fuel to make energy so you can do stuff. Well, every cell was basically inoperable, or getting to the place of being totally inoperable, where no matter what we did, because the cells couldn't do anything, it didn't matter. And when we figured out what was going on with the cyanide, we could fix it. And we went to the ICU, and what we got the history later, she had actually increased her dose. Thinking
how many was she eating a day?
Well,
curious.
I don't know where she got it, but it was, I think it was a.
Yeah, where do you get that many apricot pits?
Well, she wasn't actually eating the apricot pits. You can purchase the apricot pit powder or whatever, and you put it in a drink. I don't know specifically, really, I don't know how she was getting it. But it is a common treatment using apricot pits because of the cyanide levels. There are other pits, too, that have this. We actually talked about some of this in our poisons lecture we did. We injected ourselves with Botox, remember? Anyway, but she was taking these apricot pits, and it was basically cyanide poisoning.
Yeah.
Another toxidrome. You can see it. Once you see it, it's like, oh, okay, that's interesting. We're not going to teach that today, but
pretty rare.
Pretty rare. Yeah, I think the common ones, like we go, just to review kind of what we talked about today. We talked about opiates. Yep. So if I said pinpoint pupils and decreased respiratory drive, what's your management? Well, BVM and maybe Narcan, right?
Yeah.
What if I told you we had a patient with dilated pupils and tachycardic? Well, there's a lot of things that
need more information.
Need more information, exactly. So that's cool that we can see that, right? Okay, we need to dig deeper. Is this cocaine?
Yeah.
Or is this an anticholinergic? Is this Benadryl overdose? Or is it a serotonin syndrome?
Right.
Oh, maybe it's an antipsychotic. Maybe it's the neuroleptic malignant syndrome. If you remember that, kudos to you. It won't be in your assessment, and we just kind of mentioned that. But those are important things, and it's all built on that autonomic nervous system that we talked about. 2 parts, right?
Yep. Sympathetic, parasympathetic.
Yeah. So, and then the fight or flight versus the feed and breed.
Right. So if they're peeing a lot, they're leaking a lot, and they're sleepy.
Yeah, and they're bradycardic.
Everything's slowed down, and they're super relaxed.
Think parasympathetic.
Or
cholinergic.
Yeah, exactly. If they're amped up, you need to ask more questions to figure out.
And if they're hot as a hare, mad as a hatter, dry as a bone. Dang it! I wish I could remember all of them. But that's the anticholinergic syndrome.
Let's see if we can find it.
And I think there's an acronym for it, which I think, I can't remember. But that's the anticholinergic. So it's going to look a lot like a cocaine overdose, but it's certainly not cocaine. It's just you're shutting down your parasympathetics.
Yes, yeah. I'm looking it up to see.
Too much sympathetics.
There we go. Here it is. Red as a beet, dry as a bone, blind as a bat, mad as a hatter, hot as a hare, full as a flask. And the bowel and bladder lose their tone, and the heart runs alone.
Interesting. I did not know all of that.
The most common anticholinergic mnemonic describes toxicity as those. Or boats.
Boats?
Yeah.
What is the boats?
Oh, those are the meds.
Oh, the meds. Okay.
Yeah.
Okay.
And then while ACB, anticholinergic burden and tool measure kit.
What's the O in boats?
Oxybutynin.
Okay, cool. Yeah. Okay. And then
benzotropine, oxybutynin, atropine, and scopolamine.
Okay, the scopolamine patch.
The scopolamine patch. Used to put those on all the time as a pre-op ER or RN. Yep.
That's good.
Oh, good topic. Yeah, very obviously the opioids is probably the most common one pre-hospital that we run on. Yep. We talk a lot about anticholinergic with our atropine and stuff like that. Yep. But those are probably the 2. I've been on several people on cocaine and never had an issue. The most violent patients were the K2 ones, stuff like that. When they were taking all that synthetic stuff, those guys were super violent.
I've had a few. Actually, just recently, I had a patient that came in SVT, and no, I'm sorry, they went into AFib RVR, young kid, the guy's in his 20s, and he'd been doing cocaine for almost 10 years, and he shared that with me. And
good Lord.
Young kid, too.
Apparently.
Yeah.
Started young.
And that it's just when you combine cocaine and alcohol, it's a terrible cardiotoxin. And you're really, that he may have only been 28 or 29, but his heart was probably 60 or 70.
If I said the name Len Bias to you? No. You're a sports guy.
Yeah, what is it?
Len Bias. You remember this?
You have to teach me.
Boston Celtics rookie. They drafted him. I think he was like this. We're talking like 1990, maybe.
Oh, okay.
Yeah, he was. I want to say he was maybe the number 1 draft pick for the Boston Celtics. Yeah. And I want to say it was like the night or the week that he got drafted. He was out at a party. Allegedly, he had never done cocaine before. Did one line of cocaine and dropped dead.
Oh, it's terrible.
Yeah,
That's
I'll
tragic.
never forget that story. I don't know why that name sticks in my head, but That's why I was like, this professional athlete, as healthy as he was, took one hit of cocaine and dropped. I mean, who knows what else was going on? But
no, it's interesting you mentioned that because we were talking about some cardiac stuff earlier today, and some of these congenital heart abnormalities don't show up until you really stress the heart in some way, whether you're super dehydrated or hit up some cocaine or something like that, or methamphetamines. Yeah, these drugs that we're talking about today are very, very powerful.
Yep, not good stuff.
You know, one thing we forgot to mention, which I'll just say briefly, I'm sorry I forgot to mention this. Well, for those watching or listening, our typical guide to help us through this was not working. So we're doing this straight off of just our memory, which is not normal.
Yeah.
But we did forget one.
What?
Sedative syndrome, the sedative hypnotic syndrome.
Oh, yeah.
So overdose on benzos, overdose, which would actually, it's hitting the same receptor as alcohol. So somebody who overdoses on Ativan or Xanax is going to look very similar to somebody who's drunk.
Right.
Slurred speech, altered mental status. These patients, there's not a lot you can do. It's really supportive care.
Right.
There are some reversal agents you can use, and you got to be careful. We wouldn't carry these things.
I was going to say most of them are going to be in the hospital.
in the hospital. But it's actually fallen out of favor to even use them. But you can use them to reverse these benzodiazepines. But alcoholics, an intoxicated patient will look very similar to somebody who's overdosed on benzos. It actually hits the same receptor in the brain. But this is another relatively common toxidrome that we can see is those altered patients. You're going to have a lot of ataxia, or they have trouble coordinating their movements, but no alcohol. You might want to go think Xanax or Ativan or something like that. These are very common overdoses that we need to be able to manage. And the concern for these, of course, is the same thing with an alcoholic, same thing with an intoxicated patient or a benzo or a sedative overdose, is airway.
Yeah. Vomit and aspirate.
That's right. You're so altered you can't control your airway. I've had to intubate intoxicated patients with really high alcohol levels. I've had to intubate Xanax overdoses just temporarily, just to be able to protect their airway. So that's another important overdose to discuss.
That's good.
I think we hit them all. Carbon monoxide is one common with a bunch of group of family members on the winter morning. And then what was the other one we discussed? Tylenol. Initially normal, get a good history.
Yep.
Because you may be coming back with a very, very sick patient.
Yellow pain, abdominal pain. Yep.
But toxidromes are really important. These can be life-saving, and we can do a lot for these patients in the pre-hospital environment, which is good. Good to identify them. And the cool thing about learning the autonomic nervous system is it helps you with so many other things.
That's right.
Because it's one of those common processes in the body that we can identify. And that autonomic nervous system is what compensates for other disease processes too, right?
Yeah.
So
a
good thing to learn. So,
well, see you on the next one.
Be safe out there.
Thank you for listening to EMS, the Erik and Matt Show.